Imagine being sick and needing medical treatment but not being able to afford a doctor's appointment or even having a hospital that's nearby. Unfortunately, this is the reality for millions of Americans every day. Today, I will discuss unequal access to healthcare as an issue and explain how organizations are working to improve healthcare access to undeserved populations. Healthcare affects everyone, whether it is physical health, mental health, or emergency care. Every person will need healthcare at some point in their life. I researched a peer-reviewed scholarly articles discussing healthcare disparities, healthcare reform, and organizations helping undeserved communities. First, I will explain how the healthcare inequalities that exist in the United States. Second, I will discuss the consequences of unequal healthcare access. Third, I will explain how the National Association of Community Health Centers is helping solve this issue with people that are involved, and how you guys may be able to get involved too. Healthcare inequality exists in the United States. Many low income and minority communities struggle to access affordable health care. According to Li, Ling, and Shi in the International Journal for Equity in Health in 2021, racial minorities and low-income individuals experience significantly lower health insurance coverage. The researchers also found that many people delay medical treatment because they can't really afford healthcare services, so they are not getting the treatment that they need. This especially affects Black and Hispanic communities. Many families choose between healthcare and other necessities like rent or food. In all reality, rent and food is more important to some people. Preventative care is often delayed. Chronic illnesses become more severe over time. Healthcare disparities also affect rural communities. According to Geo and colleagues in BMS research notes in 2022, many low-income Americans live far away from healthcare facilities. Rural residents often travel long distances to receive the basic medical needs or care that they need. These inequalities support the thesis because they demonstrate that healthcare access is not equal for all Americans, and it creates an unfair disadvantage or for vulnerable groups that are different races or have different religions and so forth. Now that we understand the inequalities that exist, let's examine something more serious of limited healthcare access. Unequal healthcare access creates harmful consequences for individuals and communities. Lack of healthcare access negatively affects physical and financial health. According to Carabello and colleagues in 2020, Black and Hispanic Americans consistently experience higher uninsured rates and reduced access to primary health care providers. Without regular care, preventable illnesses can become life-threatening. Healthcare inequality also increases economic stress. Medical emergencies often create overwhelming debt for uninsured families. Many individuals avoid seeking care because it's all way too expensive. Medical bills are expensive now. These consequences relate to my thesis because healthcare inequality harms both individuals and society, making healthcare access a major social justice issue. Although these problems are serious, organizations are working to improve healthcare access and reduce disparities. Organizations such as the National Association of Community Health Centers helps reduce healthcare disparities. The National Association of Community Health Centers supports affordable healthcare services for underserved communities. Community coverage centers provide primary care, dental service, mental health support, and prescription assistance. Many clinicals or clinics also offer translation services and cultural sensitive care. Research shows these healthcare centers improve healthcare outcomes. According to Pulitzer and colleagues in Health Services Research in 2021, community health centers significantly reduce disparities in access to healthcare. Bohr, Cohen, and Gala stated in Health Affairs in 2017 that healthcare reforms and community programs help reduce socioeconomic inequalities in healthcare access. We can support these organizations by volunteering, donating, spreading awareness, and advocating for policies that improve affordable healthcare access. In conclusion, unequal access to healthcare remains one of the most important social justice issues in the United States today. Today I discussed healthcare inequalities affecting low-income people, minority and rural communities, the harmful consequences of limited healthcare and access, and the role of organizations like the National Association of Community Health Centers play in improving healthcare equality. Healthcare should never depend on a person's race, income, or what zip code they live in. Every person deserves the opportunity to live a healthy and exciting life, that they have people there supporting them, like organizations that fight for healthcare inequality. We can help create a more healthcare friendly environment or community in this society today. Thank you.